I'm Al McFarlane. Welcome to Special Conversations with Al McFarlane. We're calling this new series that we launched yesterday our focus on community organizations that are responding to the COVID-19 pandemic in our community. And every day, 7 days a week, through the end of this year, we'll be inviting leaders, organizers, agency heads to talk about what they are doing to ensure that their constituents, their congregations, their community members or stakeholders are getting the information they need, getting the services they need, getting the resources they need to protect themselves, their families, to be conscious and conscientious as we as a community attempt to navigate through the deadly COVID-19 pandemic, hopefully to come through on the other side, healed, stronger, and better as human beings, more empathetic and more aware, a better society. So I want to welcome today's guest to the program. By the way, we're streaming this live on YouTube. It's also available on Facebook Live at the Insight News page and at Al McFarlane. We invite you to like the program and to share it through your channels. We want to create a conversation throughout this month to make sure that our attention to the challenge of COVID-19 is impactful, effective, and that we educate and share, illuminate each other in the process. I want to start by connecting with presiding elder Stacey L. Smith. She's of the St. Paul, Minneapolis district of the African Methodist Episcopal Church, and she's working with the state of Minnesota on a new app. By the way, I'm reaching out to agencies and organizations that either have contracts or relationships with the health department my good job is to lift them up and have our community know what we are doing in community as community. So Elder Smith, good afternoon, and thank you for being here.
Good afternoon, and thank you for this opportunity to be with you all today. Yes, I'm not actually working as a person developing the app, but I am a supporter of the new COVID Aware Minnesota app that's out there. It is a fantastic tool that I have allowed to be spread throughout the St. Paul, Minneapolis district to really help our membership and our community. We're trying to get this out. As you're aware, the African-American community is greatly affected by this COVID virus, and we're trying to do everything that we can to make sure that not only people of African descent know, but all that are in our community know, because everyone has to help each other where this is concerned, and we all have to protect one another. So it's an important tool, and the app really notifies you and lets you know if you have been in contact with someone who has been exposed to the virus. So I'm excited about this tool because of this time and this place that we have kind of felt a little defenseless at times, against the virus. This is a tool that Governor Walz and Commissioner Thomas has put out to help the state of Minnesota. So I'm excited. But so thank you once again. I'll let some others talk and introduce themselves, I'm sure, but be glad to participate on your program.
That's fine. Thank you. We'll come back with more questions momentarily. Also on the call today, Reverend Curtis DeYoung. Reverend DeYoung is with the Minnesota Council of Churches. We are on a couple of boards together, a board together, I believe, both on the United Way of Twin Cities board. Good to see you and thank you. And after you, I'm going to introduce Bishop Fred Washington, who is the presiding bishop of the Church of God in Christ in Minnesota. And Dr. Osman is also here. And Dr. Osman, I'll have you introduce yourself in a moment. But Reverend Curtis DeYoung, thank you for being here. What, in your capacity as CEO of the Minnesota Council of Churches, what ideas, issues, programs, plans are you bringing forward to respond to COVID-19?
Sure. Thank you, Al, for the opportunity to be on your show today. And we love the work of Insight News and read it regularly. Of course, I also want to acknowledge that Presiding Elder Stacey Smith and Bishop Fred Washington are members of our board of directors. Bishop Washington is a former president of the Minnesota Council of Churches, and Elder Stacey Smith is the incoming president of the Minnesota Council of Churches. So I'm so glad they're with me today, representing us as well as their own ministries. One of the things that we've been doing to serve the church community is hosting, first on a weekly basis, but now every other week, a call for the heads of denominations to have direct contact with the Minnesota Department of Health. So that way we keep our church leaders up to date with the latest information coming out of the Department of Health on what's happening with COVID. Elder Smith is on that call. Bishop Washington is very much on that call on a regular basis. It's also been an opportunity for the heads of denominations, and this includes not only our members, Black churches, the mainline Protestant churches, but also the Roman Catholic Church. Archbishop Hebda is often on there, evangelical churches, and even the Minnesota Rabbinical Association has a representative that joins us. And this is a chance also for us to share across our religious organizations and denominations what we're doing and come up with common ways to address that. Also, Minnesota Council of Churches does work in refugee communities, and so our refugee staff has been doing a lot of education to help people understand really what COVID is, how to keep yourself safe, and how to operate in this context. And we have translators working with us, and obviously with the Somali population being such a large portion and more recent refugees, we've done a lot of work in Somali populations as well.
Let me shift then to Dr. Osman M. Ahmed. Dr. Ahmed, thank you for being here. Good afternoon. And take off from there. Talk about the impact and the challenges, particularly for immigrant communities, immigrant African and African American communities, how we do all we can to ensure people have the information they need and the resources they need to be healthy. And you have to unmute your mic, Dr. Osman. And there should be a button or a microphone icon at the bottom of your page that's got a mute in it right now. You can unmute it. There we go. Thank you.
You hear me now?
Perfect. Yes.
Good afternoon, everybody. My name is Dr. Osman Mahmoud Ahmed, but I am famous with Dr. Osman Harare. I am medical doctor. I graduated from Soviet Union long time ago. And I took that specialization of pediatrician. After 10 years, I worked in Somalia. I go back to Italy for 3 years for specialization of the infection disease. And I go back again to Somalia, and I worked there until Civil War. After Civil War, I ran out from country, and I come in United States 1995. I was 1 year in Atlanta, and 1996 I was in Minnesota. And since now I am in Minnesota. What I am doing is educate community. I worked in Hennepin Medical Center 11 years as a Somali advocate. What I did that is how to teach Somali community navigate health system, because the health system was different between Somalia and United States. In Somalia, the health was free of charge, and education was free of charge. Non-insurance, nothing, non-appointment, non-primary health care. And you go there and take visit and go back with medicine too. But when they come here, it's completely different system and need insurance, need primary health care, need special clinic. Everything completely different. At 11 years, I spent that to educate community how to navigate. I founded the East African Health Project, which I am executive director 2004. And since that, I am educate Somali community about chronic disease, infection disease, and absolutely as a consultant. I use, when I educate Somali community, 3 different ways. One is conference call. This is a very, very powerful conference call. I educate not only Minnesota, but all United States, Canada, Europe. All in this life, and everybody take and I take question from that people everywhere they are. Although their time is different, but they are awake and ask the question. And also I use Somali National TV. And when I do that, they put in the social media and that education even in Africa. Also, I use what we call a radio show too. We have to radio show. And this thing I am reaching almost every time from 500 to 1,500 people. They are listening. Really, the challenge is we as an African American, we must break the health disparity. This need to educate community, because you see two people who have the same insurance, one suffer health disparity and the other one no, because the other one has full information, full knowledge about what is right. And our community, they not know that, although they have a right to access every clinic, have the insurance, the same time they have difficulty to understand their own rights. Therefore, I am educating community about that. You have insurance, and when you go to doctor, the doctor is employee. You are employer. You must understand that. And this, the health disparity, all the health, the cause of the health disparity is lack of the knowledge and information. And we must break that. During the coronavirus, this disease is very, very dangerous disease, and really everybody know what is cause, how the damage in United, this is a pandemic, absolutely. It's everywhere. Although United States is worse now when you see other country, absolutely. And we must fight these diseases. And I educate the community to use only 4 things. This: stay home, wear mask, hand, and safe distance, 2 meters.
Protocol.
That 4 things, if you do, you can be safe for that disease. And
Let me
think what I am doing with this thing. Thank you.
Fantastic. Let me bring Bishop Fred Washington in. Bishop Washington, so good to see you again, and thank you for all that you have done and continue to do, providing service, leadership, inspiration for our community. Please unmute your mic so that we can hear your voice, and talk about the work that you're doing and the experience of our community, and why and how it's important that we engage, that we communicate, and that we demonstrate our intent to be acting in our own agency to protect ourselves and our families. And I want you to respond to, in part, some of the things that Dr. Osman talked about, because he mentioned, one of the challenges is the amount of information. 2 people, same age, same insurance company, one has one outcome, one has another. Is it simply a question of knowledge, or is there a history of structural barriers? I call it racism in our society and culture that is reflected in the health care delivery system that exacerbates and that makes it more likely that person A will be less healthy than person B. But welcome to the program, Bishop Washington.
God bless you. Thank you, Reverend Al. And first, let me say I thank you for the great work that you do in our community, and for the president of Insight News that keeps our communities informed.
Thank you.
Well, I as Reverend Curtis DeYoung said, I served with him on the board for the Minnesota Council of Churches, and I want to say to him, he's done a tremendous job in providing us leadership. And I've also worked with Reverend Alfred Babbitt Johnson, His Works United, and for a while we were serving as beacons for the Department of Health, getting the information out about the various information needed for COVID-19. But to your point is, I've been in Minnesota now for about 52 years. And I often say when I came here, I thought I was coming to the promised land, but I found out later that I was still in Egypt, because there is systemic racism right here in Minnesota. And I had the bad experience of seeing my wife going through the health system. And because of her, she had a little touch of loss of memory. I saw the discrimination that was against Black African Americans and Black females. They didn't want to give her the proper care. I had to be there all the time. So yes, I think there has been so much health inequities in our health system for so many years. And for many of our people, we can't get good health. I think the Affordable Care Act was a godsend for our people because a lot of time they couldn't get health insurance because of their preconditioned experiences. And there is systematic racism. There is inequity in the dispensing of help to our people. Even in the hospitals, I see when I was visiting there a lot, I could see the difference in treatment for people of color than from the majority race. And so, yes, there is systemic racism in Minnesota, and particularly in the healthcare. And I trust that we can resolve some of these issues because you can see people right by each other and one gets the care, the other one doesn't. And so I hope we can come to some solution. What I'm trying to do is to inform our communities because I think Reverend Stacey mentioned about the high susceptibility and vulnerability of Black and Brown community to this disease. And I've spoken out because of the misinformation that has been given to us. I worked in the health service field for 26 years at the University of Minnesota Hospital Pharmacy. And some of the information that came out about the mask and about all of these things, I knew that was misinformation from the very beginning. Mm-hmm. And so a lot of people I feel got exposed and died to it because so many believe everything that comes from the health experts, which they should be able to do, mm-hmm. but how so much misinformation. And I put out a video to our people early on that from my experience in pharmacy, masks will protect you from catching the disease. When they were saying it was to protect the other person, I told the people that I should wear the mask to protect yourself. I put out a video about the need for mass testing early on. I'm not an epidemiologist, and am I infectious disease control doctor, but just my experience told me that to control anything, there need to be a lot of testing. Mm-hmm. And that just now beginning to happen somewhat in our community. So I think there's a lot of structural, I would say, racism, systemic, and I know we don't like to own up to that, but there is a lot of that going on. So I'm trying to keep my people informed, mm-hmm. even about the upcoming vaccine that's coming out. I'm trying to keep them informed so they will know what to do and how to do to fight against this equity, the inequity that they're facing.
I want to ask all three of you to talk about the question of the public's general hesitation about the vaccine, the pot that's been stirred in a negative way by our president, Donald Trump, and his ability to create doubt in the general public. And what is the impact of that? That's one question. The second question is, what particularly capabilities do you have as church leaders to bring your congregations and your neighborhoods into an awareness that enables them to make the best, most informed decision about practices, as you've just described and as Dr. Osman described, but also about solutions that we hope will be arriving with the vaccination and with other therapies. What particular power role ought the church leadership be playing? Elder Smith first, and then you, Bishop Washington, and then Curtis DeYoung, and I'm going to bring it back to you after that, Dr. Osman. But Elder Smith?
Okay, thank you. Well, you know, the African-American community is very skeptical, and we know this. I mean, and there's a long history of that. And not only to mention that, you know, just what Bishop Washington was just talking about, with the fact that, you know, it's the healthcare, even when we get it, is not what it should be. And we can see the difference in one person versus another, or one race versus another. So the skepticism of what we would receive is there. And the skepticism about, you know, are we going to receive the correct type of vaccine? Are we going to receive the full power of the vaccine? Is the vaccine going to be a harmful vaccine to us? You know, so that skepticism is there, and rightly so, you know, down through the years. You know, I am witnessing this firsthand of what Bishop Washington was saying. I have a relative, my sister, who is going through some very difficult things just to have a surgery. So I'm seeing this fold out in action right now, and looking at how that is happening. But now, as we move to, you know, providing information to our community, you know, really it's education, 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 as what Dr. Osman was saying, following the protocols, trying to provide, you know, our membership and our community about exactly what's happening. There is so much false information out there right now, and negative information. So really trying to stay up to date with what is out there, what are the resources, where to go and get those resources. You know, it is truly important to make sure that we are able to provide that. And as Dr. Washington said earlier, is that, you know, we were beacons, and we still are the beacons to get that information out to our communities. But it is difficult, and you know, we can tell people, but the past tends to always jump in the way. You know, it always tends to come right back up, you know. And I've heard, you know, people tell me that, well, I will wait till they have 100,000 people vaccinated, and then I'll see how this thing goes. So, you know, I can't tell people exactly what to do, but the information and correct information and education about what we can do is the key to all of this, and following protocols in the meantime of waiting for the vaccine.
Reverend DeYoung, respond to the same question, but I'm going to add something to this for you to respond to. The pandemic, COVID-19, but there's also a social justice pandemic going on in this city, George Floyd, and in the world. The pandemic that started with 1619, the importation of human beings enslaved, and the country's unwillingness to face that squarely, consistently, but at the same time promote this idea that is still a great idea, that we represent the potential for justice and equality for all. How do you bring those things together in a discussion that illuminates and elucidates the population, the congregation, about what our responsibilities are and should be, both for health and for the social, cultural, mental, religious health of our people?
Thank you for that question, because I think that COVID-19 and what some folks are calling COVID-16-19 are very closely tied together. And in a time where we can't trust the voices coming out of Washington or government, faith leaders play a much more important role in being trusted voices. So when it comes to the health concerns and how to address those, we have to be speaking out as faith leaders and encouraging folks to practice the protocols, to get the vaccines when they come out. And we're going to have to probably repeatedly say that. Just one more thing on that, and then I'll turn to COVID-16-19. But one of the ways that we've been practically trying to partner with Stair Step on this, and Reverend Babington Johnson, is that there are a lot of our buildings right now that are not being used because we're not holding worship services, or they're only being used sparingly. And so we're being able to open some of those to be testing sites that Stair Step is facilitating. And so we're grateful for that opportunity. We have some, you know, especially some of the larger white churches have big gymnasiums with lots of space and work real well for a testing site. But the reality is it's that and I like the term pre-existing conditions, because one of those pre-existing conditions is racism. And, folks are born apparently equal, but there's this pre-existing condition of racism that might even affect you before you're born in prenatal care and other kinds of ways. But that completely shapes our experience with healthcare, with in every other kind of thing. And Minnesota has some of the highest disparities, racial disparities in the nation. So we've really made a focus on this, starting early in COVID-19. Leslie Redmond, president of the NAACP in Minneapolis, invited me to join her on an op-ed to say, we have an opportunity now because we can see these disparities so clearly in the way things are happening here with COVID-19. And then with George Floyd's death, the whole world is looking at us in Minnesota to see how we're going to respond. And the Council of Churches, and thanks to Elder Smith and Bishop Washington and many other leaders among us, have decided to step out and initiate a truth-telling process and a reparations process, because we got to tell the truth about what's happening and why these disparities happen. These just didn't happen because they happened. They happened because there's systemic ways of keeping them in place, and because there's been harm done to communities of color, particularly African-American and indigenous communities. But that has to be repaired. And reparations will probably look like a lot of different things, but we have to address the uncompensated wages over generations, because ultimately a health disparity underneath it is an economic disparity. Part of it is because communities do not have the resources that they need. And so we at the Council of Churches are committed over the next 5 to 10 years to make this our central focus in our work.
Dr. Osman, you talk so powerfully about the need and your experience in connecting with people via technology all over the world. And so while the principles, the instruction is very specific, wash your hands, wear a mask, social distance, and be aware of treatments and remedies and vaccinations as they occur and are made available. The power of your statement, to me, is that you are engaging technology to connect and engage people beyond boundaries, beyond the boundaries of North Minneapolis or South Minneapolis, beyond Minnesota, but throughout the country, and you reach out to Canada and other places in the Somali diaspora. Is there a lesson there that all of us should pay more attention to? Are we African Americans in particular, from your point of view, sometimes too parochial? Are we limiting our sense of what we can and should do and be by our focus on boundaries that have been prescribed for us that don't really have much to do with our innate core humanity? Is there a way, a pathway that connects us to and through our humanity with our people all over the planet in ways that will bring benefit, change, and the attainment of the equality we talk about? Because it's not just in America, it's really a global problem. The question of racism we talk about in the US is no different from the question of colonialism in Africa, right? That's the same pandemic, different names. And so we've got some things we should talk about differently, but the talking should be the pathway to solving the problem. So I'm going to stop there and let you respond to the drift of my thought.
I think about vaccine. First of all, the vaccine, when you use, you must know how it's effective and how it's safe. To think we must know before we accept the vaccine. This vaccine of coronavirus, the community already, they have absolutely some, no, because some people they call Trump vaccine, I don't get. Some people, they said, this is a new vaccine. What is going on after I take? That very, very difficult. And already some people started against the vaccine. I saw some video talking about vaccine is created from human. It's absolutely negative thing. Therefore, we must have full documentation of the vaccine from CDC, from doctors, to educate community before, say, take vaccine. This is a new vaccine. Nobody know still how it's effective. We hear now some people who get coronavirus, they reinfected again and they get second time the same little time period, 2 months, like that. Therefore, the Somali community is very, very awake about this vaccine and said, we must know from doctors, from WHO, from CDC, is this vaccine is effective and safe. Therefore, need more education really about this vaccine. And the Somali community always, they have sometimes negative thing. We have Somali who have a negative about MMR because of the anti-vaccine group.
Right.
This vaccine causes autism. And I am inviting almost 10 years, said autism exists before the vaccine come out. Therefore, it's very, very, still we have this difficulty. Now this new coronavirus started from very politician people, and that they said, oh, no, this is Trump vaccine, I know when get that one when come out. Therefore, need more education about this vaccine, how it's effective, how it's safe, and how the people can get. Therefore, please, we must talk with CDC or doctors, the people waiting some documentation, knowledge about this vaccine.
Okay, and thank you. So the question is, you said the answer is knowledge, information, and the attitude seems to me that we owe it to ourselves. We must empower ourselves to pursue and attain the knowledge that will allow us to make the best decisions. Like your community was particularly challenged by the vaccination question because of that concern, that fear about autism being created by vaccinations. And I think the community has successfully overcome that. And that's been because of education, people talking about the value and the need to protect the safety and health of children. But are there other outcomes, other strategies, Bishop Washington and Elder Smith, that are married here? So I use the term a lot. I say, my grandmother used to tell me, boy, mind your business, right? And then I take that and interpolate it to this notion of my health is my business, is my business, right? And so how do we get to where we internalize this idea that our health, our well-being, our spirit is our business? We have an obligation and a duty to mind it, meaning to pay attention to it, meaning to direct it in accordance to whatever it is that drives us as human beings. Bishop Washington, what do you think?
Well, I agree on that. I have a little struggle about the vaccine personally. And then I know why a lot of our community does because of past historical events like the Tuskegee event and things like that.
Mm-hmm.
I don't want to depend too much on my brief pharmacy career because I remember it said a little knowledge is a dangerous thing. So drink deep or taste not spring. But to me, this vaccine has I need a lot of answers coming from the experts because in my experience, it takes more than 3 months to develop a real effective vaccine, sometimes up to a year. And I know technology has really advanced since I left the field, but most time the first vaccine come out like an efficacy of 70 or so, but this 94, 95 seems really high. So I would like for the truth to just come out that the FDA, the CDC, and all these other organizations really get the answers and the questions answered in the mind. Right now, I have to confess, I struggle even at my age and need that, whether I want to be first to take this. But I do encourage the people to weigh it out, get the facts, and then they have to make their own personal decision. But I think it's going to be a real struggle to, we don't have that anti-vaccine uh, 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 philosophy because I take other vaccines. I believe in vaccinations to protect from diseases. I think this one, because of a lot of the misinformation and a lot of the messaging that have come out of Washington, that it's going to be difficult to convince our people. But I will encourage them, get the knowledge, educate themselves by listening to the experts. I think the messaging will change eventually and the facts will really come out. And once the facts are out, I encourage them to do that because I agree with your grandmother. We have to mind our own business and make sure we take care of our well-being. And if that vaccination proves to be effective, I encourage them to take it.
Elder Smith, what do you think? What are your thoughts?
I worked in the health insurance industry for about 13 years, and I have seen all types of cases that come through and talking to people. I ran a call center in the health insurance industry for years, and it was really working with those who were either on Medicare or they were self-insured.
Mhm.
And one of the things that I found in working in that industry and hearing people calling in is that you hear people constantly questioning, is this safe? And from the health insurance, I'm just, interpreting your insurance benefits, but they're always asking questions. Well, in your opinion, is this something safe? Is everybody getting it? There's been a lot of people calling in about this. And in our community, we have, those who, number one, who are working several jobs. And self-care, well, you talked about self-care, minding our own business, but being about our business of our body is, we don't have that time to get the education properly to understand, is this good for us? Because we're too busy minding our business of trying to get our bills paid, trying to keep a roof over our head, trying to keep clothes on our back and food on our table, and working 2 and 3 jobs. So, and because of the salary is disproportionate in the Black and Brown and Indigenous communities. So one of the things that in minding our own self-care, it is important for us to really put forth information to our communities and all communities really, but our communities about what this means. And a lot of people, just as Bishop Washington said, 94%, 90%, that's not a 100% for people. And so they are skeptical and they want this information, but being able to find a place, because like I said, I worked in a call center. People want to know, where can I call? Where can I get this information? How can I be reassured that this is going to be okay for me? Is it going to be okay for my children? Dr. Osman talked about the measles, mumps, rubella, MMR, people thinking that it caused autism, but once again, autism was always out there. There are many diseases that have always been with us and amongst us, but we don't have that education. We don't have that wherewithal to know those things. So providing, that resource, and that's what churches are trying to do right now. We're trying to be that conduit between the medical field and those who come and visit with us each and every Sunday, and they trust us. So we're trying to provide the most trusted information. That's just why I'm excited about this COVID Aware Minnesota app, because it is trusted. It is something that will provide that level of comfort to our constituents, to our membership, to those who we are supporting in our communities. So, really, once again, education, information, but trusted information is what our community needs.
We're about out of time. We've got about 3 or 4 minutes. I want to ask each person to sort of make a closing remark, but I want to first thank you all for what you are doing, and thank you as well for being here on this call today. This call is the first of one that we'll be doing daily through conversations with Al McFarlane, talking to people like ourselves about what we are doing, what we think, what we feel, what our story is, what our narratives are about how we navigate the pandemic, the twin pandemics, and how we move towards healing, health, restoration in our community, in our society, and for humanity. And I think all of you have spoken to that in a very generic way, from the personal and local, but in ways that reflect the universal and the global. And that's the power of this conversation. Thank you, Dr. Osman, for your work at the East Africa Health Project as a lecturer and as a physician. Thank you so much. Reverend Curtis DeYoung, thank you for your leadership with the Minnesota Council of Churches. Bishop Fred Washington, former chair, I guess, president of the council, and bishop of the Churches of God in Christ in Minnesota, and Elder Stacey Smith, the presiding elder of Minnesota's African Methodist Episcopal Church. And this program is underwritten by the Minnesota Health Department. I thank them for allowing me to convene these conversations every day. We'll share these out on YouTube, on Facebook, and other social media platforms. We'll present this conversation as part of our daily e-newsletter. We call it Insight Culture. So we've got several thousand subscribers, so we'll get this every day. And these stories will appear in my newspaper, Insight News, and on our website, insightnews.com. So we're working to use all the channels available to create a new narrative about our engagement, our intent, and our obligation and our right to bring our voice and our solutions to the problem. So let me ask you all just to give a parting thought. I'll start with you, Bishop Fred Washington. What would you tell our listeners and viewers to have top of mind as we navigate daily and seek to remain healthy?
Well, I'll tell them, until we get better information, to continue to mask, to wash your hands, social distance, and be educated about the future, about COVID-19, the challenges it presents, and the opening up of the vaccine. They make sure they get the good information about that, and once they are convinced that it's good for them, to take it.
I'd be remiss if I didn't ask this question to the church leaders, Bishop and Reverend DeYoung and Stacey Smith. How do we encourage our people to understand both prayer and science? Sometimes we're presented with the idea that if we truly believe, we don't need the value of science, and therefore we turn a deaf ear towards even the recommendations that you just made. How do we explain differently so that we fully, I'm not sure of the right words, but I think the discussion I'm having with myself, Bishop Fred, sometimes there's a sense of conflict where there should not be one, about if I trust science, am I not trusting my God? Or if I trust God, does it mean I have to turn my back on science? How do we negotiate that conversation?
Well, the way I negotiate it even now, when I tell the local churches to not really open up because of the threat of COVID-19, I tell them I studied science. I was in science, like I said, a 26-year career. But to trust science does not mean you're not trusting God. I trust God, but I don't tempt God. And that's what I usually say to them. And if I might say this quickly, Jesus was on the pinnacle of the temple, and they tried to get him to jump down because the angels would bear thee up. I believe the angels would have borne him up, but Jesus also said, thou shalt not tempt the Lord thy God. And so I say to you, God has given scientists knowledge to treat our sickness and diseases. And to do that does not mean that we don't trust God.
Elder Smith.
Thank you. And thank you for this opportunity to be on the show today. It's an awesome privilege, and it's been great conversation. What I would like to say about that concerning telling our membership and things is about science versus, our theological world is this: God is the creator of this universe. And because he's the creator of this universe, he created science. He created those who apply science. He created doctors. He created researchers. He created all of the medical field. And therefore, I like to believe that, for my personal belief, is that science and math equals truth, and God is truth. And therefore, it's not an if, and, or that, or this. It is all of the above. And that is who our God is. He is an all-consuming God. And so therefore, we can trust what science gives us because God has created it to provide for us.
So Curtis, DeYoung, how do you articulate the same or discuss the same question and put in context the history of what I'm going to call white religion and Black people?
First, I would say I think that Elder Smith and Bishop Washington have made it plain, as you might say at church, that God is the creator of everything. But that doesn't mean we stop praying, because there's a role for prayer in not only helping us sustain ourselves through this work, but God is a God that does still heal. And we want to know that we trust that God. But we trust science, and we see science as a partner to God's work. And sometimes you just have to learn that through your own experience to really own that. I would just also add, as we're looking forward, we will eventually get past COVID-19, but COVID-19 is still here. So as we move forward, we need to not lose the lessons that we've learned and forget about what we've seen about racial disparities, and stay focused and committed to address racism in our society, much of which the white church has been complicit as. And so the white church itself has to go through a process of self-introspection and what we call in the faith community repentance, and go in a new direction and be in concert with all humanity trying to address racial injustice.
Dr. Osman, the final word is yours. What ought people be thinking about today?
I am thinking the most important is educate community. And I rarely use the word when I talk with community. Please save yourself. When you are save yourself, you save other people too. Therefore, stay home, wash your hand, wear mask, and safe distance to meet the other people. That's my constant message to the community.
What a wonderful program. I want to thank all of you. And I'm going to put your contact information, share it between you so that you can stay in touch. But this has been a great conversation. I thank you all so very, very much. I'm Al McFarlane. If you like this conversation, we're doing this every day, 7 days a week at 12 noon, connecting with people in our community, in our culture, talking about our response to the COVID-19 pandemic, and as Reverend Curtis DeYoung said, how that's impacted by the pandemic, the 1619 pandemic as well. So join me again tomorrow, and be well, follow the protocol, follow the instruction, and we'll see you tomorrow.